what we looked at a large group of people. It was over like 7 million nights, over 150,000 individuals, and basically was an under-mattress device. They're also called nearable devices because they fit under the mattress, and they detect movement, but also respiratory rate, heart rate, measures like that. And when we looked at this cohort, we were able to look at the prevalence of sleep apnea. And what we found out was that it was about less than 50 years of age. It was about 3% of women, 12% of men. And then what happened was over the age of 50, the odds of the risk of developing sleep apnea would be about seven times for women, about 4.5 times for men. In addition, we found out that when we looked at the data for moderate to severe and severe individuals that had sleep apnea, it's about 5% of the time that they jump classes, meaning that when you look at their average severity of the apnea over a year, and you look how many or what percent of those nights they actually jump a class, going from like severe to mild or moderate severe to normal, those are jumping 2 classes. We found it's about 5% of the time. And then when we looked further at the data for 5 randomized nights, what we found out was that roughly about the sensitivity is about 90% or higher. If you look at 3 nights, if you go higher than 3 nights, there's a trade-off for the specificity. So what that means is if you look at only 1 night, it's about 70% of the time of detecting sleep apnea. But if you do 3 nights, that raises the sensitivity. And that has implications for overnight sleep studies. Because if you do only 1 night of study, you might not be able to detect sleep apnea that well. So one of the outcomes of the study was to look at 3 nights. That's sort of the sweet spot